Welcome to week 7, mini lecture 2 on the spine and pelvis. This is our first week of 2 weeks on this region. And in this particular episode, we'll talk about the pelvis and sacroiliac stabilization, which is sometimes also referred to as core, trunk, or pelvis stabilization. These terms are all synonymous with each other. So that being said, we will get started. And in this particular episode, I should also emphasize that we discuss the lower spine and pelvis more so than the upper spine. In this course, it is the pelvic stability and recruitment of the core that really influence the upper spine because of its muscle attachment sites. But know that it is also the lower spine and pelvis that tend to be subject to injury. And what we're looking at here in this particular slide is the sacroiliac ring. And this is essentially the formation of the sacroilium and the pelvis that come together, creating a closed ring that connect the left and the right sides of the pelvis, also known as the hemipelvis. Each hemipelvis consists of an ilium, pubis, and ischium, which are connected anteriorly at the pubic symphysis joint. Posteriorly, they are connected by the sacrum with the two sacroiliac joints on either side. Now, the pelvis is a platform for which there are 3 large levers that are attached. These levers are the spine and 2 lower extremities. Because of these direct attachments of these segments to the pelvis, they have direct impact on the pelvis, and likewise the pelvis can influence the function of these various segments. When we take the pelvis, the lumbar vertebrae, and the hip joint together, it is referred to as the lumbopelvic hip complex. What you can see in figure 17.1 from your textbook is the diagram on the far right of your screen and how these segments are related to one another. So firstly, an anteriorly tilted pelvis will place the hips in more flexion, while a posteriorly tilted pelvis produces more hip extension. Lordosis of the lumbar spine also causes the pelvis to tilt forward or anteriorly. Now, as I mentioned, we are going to discuss in this particular lecture episode about pelvic or sacroiliac stabilization at the sacroiliac joints. These are very large joints in the spine complex. However, the motion within these joints is known to be rather small. There is some disagreement about the extent of the range of motion at these regions, but once again, it is small. It is somewhat variable, but it may be also responsible for back and pelvic pain. Stabilization of this particular region is important for relieving pain and also transmitting force up and down the kinetic chain between the extremities and also your trunk. As a result, having a good mechanical relationship within the spine, sacroiliac joints, and pelvis is important for optimal function within daily living. Notably, The pelvis provides stability in three ways, and they are listed here: through form closure, force closure, and neuromotor control. Let's take a look at each of these in a little bit more detail. So first, having a look at form closure, this essentially refers to the stability of the pelvic ring provided by the joint's shape and structure. Form closure is as a result of the joint's shape and the ligaments that support it. Notably, the sacroiliac joints have articular surfaces that will change with age. So while one is young, these joints are generally have smooth surfaces, but by middle age, these surfaces become ridged and grooved. There are also ligaments that add stability to this region. However, these ligaments undergo stress and changes in the ligaments or bony injuries can lead to impairments in this stability within the pelvic ring. Now, this is in contrast to force closure, which is the stability provided by the dynamic forces acting on the pelvis. Force closure adds to the stability of the sacroiliac joints through muscle activation, can actively protect the joints and secondary reinforcement to the ligaments as well. There are a number of muscles in this region that contribute to provide active stability during movement as well. And two of the most important muscles or muscle groups in this region are oriented in a transverse direction relative to the sacroiliac joints. These include the transverse abdominis and the pelvic floor muscles. These two muscle groups are integral to force closure and pelvic stabilization, particularly during movement. Once again, force closure, or the stability provided by dynamic forces that act on the pelvis, can be reduced with muscle core injuries. Lastly, the third component or element to creating sacroiliac stabilization is that of neuromotor control. Neuromotor control, as you know, is important to normal function of any body segment. Injury and pain often create a disruption or impairments in neuromotor control as well. Patients with sacroiliac pain will have poor recruitment of muscles in this region. It is therefore important to correct muscle activation and timing to optimize stabilization in this region. Now, as I mentioned as well, neuromotor control is integral to stability, and this is subject to both feed forward and feedback systems. So a feed forward system is used when a stress or load is anticipated and muscles are set in advance to create the stability needed to manage the anticipated load. As an example of this, the transverse abdominis will normally fire or activate before the shoulder muscles do, as the body prepares to throw an object. But individuals with, for example, low back pain may have impairments in creating this stability. And in closing, I should add that when all three of these systems act together, so that includes, once again, form closure of the sacroiliac joint structure, force closure created by the local and global muscles of the core, and neuromotor control provided by sensory input and feedback to and from the central nervous system, what will result is stability, refined movement, and power transmission. Therefore, the interaction of these three elements is necessary to maximize stabilization in the sacroiliac joints.